What is going on, YouTube fam? And in this video we will be discussing Suboxone again. I've made a video on it before in the past, but I wanted to go ahead and I wanted to do this again and emphasize the importance of some certain facts in regards to Suboxone. We'll be discussing that in somewhat methadone. Suboxone and Subutex are somewhat similar though, but the big thing is we're going to talk about Suboxone and methadone. And I know I might get some judgmental people in here saying you don't know what it is. I might not have taken it, but I've seen a lot of patients in an inpatient setting and an outpatient setting who have been in opioid withdrawal and have started Suboxone, and I've learned a lot about the different side effects through different assessments and whatnot, and how to assess patients when they first start Suboxone. So have I taken it? No, but I am an RN and I have seen a lot of different side effects, what to expect, when are you going to get your first dose, common side effects that you might that might occur when you first start, some very important facts in regards to how other drugs work with Suboxone. So yeah, please like and subscribe to this channel if you like this content. So let's go ahead and jump right into it. And hit that subscribe button, it's somewhere down there. So let's go ahead and jump right into it real quick. So, Suboxone is typically, as you all know, I know you know, it's a lot of times used for people who have an opioid addiction or an opioid problem. And let me go ahead and clear this up. Before I became an RN, I used to look at Suboxone, and I'm just going to tell it as it is. I used to look at it as being, oh, you're just replacing one thing for another. I used to be like, well, if you use that, that's essentially the same thing as using heroin or opioids, or if you had a Oxycontin issue, oh, you're just switching one thing to another. If you're using heroin, vice versa. But as I started working and understanding these programs in the actual settings, I really made a 360 turn in regards to it. I've seen it, I'm not going to lie to you, I've seen for some people it really, really helps them get their life together. There's plenty of people who have YouTube channels on here that you can see who've had heroin or fentanyl issues, and now they're on Suboxone and it works really well for them. They've got their shit together. They're working jobs. I was not a candidate for it. Tramadol isn't really something that is it's not been studied enough to know if that is something to go to Suboxone yet. I know there are a couple people who actually have been put on Suboxone, but how I've seen it, there just isn't enough research yet to quite jump to that conclusion for me to see if it's effective. One person I know it's been effective for, another not at all, and this is for Tramadol. This is a drug I had a problem with. However, I'm not going to say it won't be at some point included in opioid dependency programs, but for right now we just don't have enough research, and that's what I really base anything I am advocating for typically has a research aspect behind it and experience behind it. For example, even you take something like what really helped me get off Tramadol was Kratom, is as much as people want to say there isn't enough research for it out there, there is more and more research coming out. And for me, that was the thing that helped get me clean off Tramadol and helped me. I don't have any urge to ever drink. Let me clear this up, I was never a huge drinker, but when I did drink, I liked to get shit-faced on the weekends, but I wasn't a daily drinker. But that's why I still will use Kratom to this day, and particularly if I'm going to go out, just to avoid the whole drinking thing, because it makes it where I just don't have that urge to drink or even have a beer. One time, a couple weeks ago, I went out and bought a beer. It smelled like alcohol, and I put it right down. So does Kratom have an effect with alcohol? Meaning, does it help you stay off alcohol? There is a couple studies, but once again, we don't know for sure until there is even more research out in regards to it. But for me, yes. So let's go ahead and jump back into the topic of Suboxone, because I'm at currently the new job I'm working in. It's an inpatient setting. I'm an RN, as I've told everyone, and I work in an inpatient setting in regards to people who have drug addiction issues. That's one of the units. I'm kind of like a float nurse. I work on a unit for people who have drug addiction issues specifically. Typically, a lot of it is opiates, opioids. You do get some, though, people who have problems with uppers and downers as well, meaning benzos, which you have to be, those are the people you have to be very careful with because you just can't quit that. Seizures are a big problem with that. So if you're ever thinking about quitting your benzo cold turkey, be very careful with that. I highly advise you to seek professional help with that because I've seen people have seizures many times. Alcohol withdrawal as well. And then another floor, how it is where I work in the state I work in, they separate dependency issues, so alcohol, drug issues, they separate it completely from people who have mental health diseases, such as schizophrenia, psychosis, etc., etc. The only place it can get tricky, though, is when you have somebody who has drug-induced psychosis, where to put the patient. But anyway, I'm digressing and getting off the topic. Anyway, so let's discuss real quick, and I'm going off of, I have actually an opioid dependency program pulled up, and this is a very highly regarded one. It's by Alberta Health Services. I can leave the link if you want, or I'll put it in there if I remember to. But the stuff I'm going to be talking about are specific. It's a really long manual, but I'm just going to be, I've pulled out specific information that I have seen from past jobs and what I've seen the most of from questions patients have, and specific questions in regards to when will it start working, when does it kick in, when do I start the medication, when do I start Suboxone, do I go from methadone to Suboxone, vice versa. I'm going to be going over these common questions because these are typically for somebody who just gets on, starts it. These are very common questions, and you should ask your doctor about these because sometimes they're not. You go in there to the Suboxone clinic, for example, and your psychiatrist or whoever sees you for 10 minutes, and then you're gone and you have a million questions. So this is for anyone who's starting it, who feels like who has started Suboxone as well and feels like they don't exactly know everything that's entailing. I'm going to try to answer some of these questions. And also, if you want, you can leave some comments down in the comment section, and I will get back to you and answer them. Once again, I am not a doctor. I am a medical professional, though, so I can answer questions as honestly as I can. I just can't answer questions in regards to you saying, do you think I should get on this medication? Doctors make that decision. I can answer questions in regards to side effects, symptoms, education in regards to Suboxone or methadone. But I cannot say you are a candidate for it. All right, so let's jump into it. So I'm going to go ahead and start out with this. This is very important. Suboxone in pain management. Unlike methadone, Suboxone, and this is really important, blocks the effects of other opioids. So Suboxone, so let's say you've been taking things like codeine, morphine, Percocet. So essentially what that means is these pain medications will not work as well if you are on Suboxone. And the reason why I wanted to start with that is because a lot of times patients, right when they come in to the setting, typically right away, they will, this is an example of somebody who's been on Suboxone and whatnot, and they come in and they've overdosed on something, even something kind of like heroin, or as I've said, oxycodone. And they're like, well, I like to mix it, but I just wasn't getting the same effect of it. But the reason being why you're not getting that effect when you're mixing them, expecting some crazy result, is because Suboxone, as we said, it blocks the effects of other opioids. So that is one thing that I wanted to let everyone know. Do not combine Suboxone with other meds. So if you're going in there just trying to take it to get high, Suboxone, what typically ends up happening is somebody runs through their dose and then tries to mix it with something else, the rest of it, and they're not feeling the effect of that oxycodone they mixed it with, and whatnot. That's why they do drug tests when you go in there. They like to P-test you to make sure, because you'll end up taking more and more of a street drug and then you'll overdose. So yeah, that's what I wanted to go and let you know in that regard. So just remember, let's say you run out of even your Suboxone, and you're like, oh, I've got some hydrocodone or oxycodone over here, and you take that, replace it, your brain will not, you will not feel it the same way, because Suboxone also it can take a couple days to get out of your system. The half-life isn't quite as long as methadone. Methadone's in your system even longer, but at the same token, that is a lot of reasons why they will P-test, is because they want to make sure you're not mixing meds. So this is a really big topic as well. People also ask why, and this is regards to the first dose. Why can't I start Suboxone? Let's say you literally had just taken your last hit of something, you're an inpatient, or you go to a clinic and you go, I want to start this right now. I want to start Suboxone right now. Your first dose, it is very important that you are in mild to moderate withdrawal before you take your first dose. And let me tell you, this is very important, because as I said, if you have other opioids in your system, taking Suboxone is likely going to send you into actually severe withdrawal. So I've seen this as well. That's again why they like to make sure they'll drug test you. Even if you test positive for something, they can typically even narrow it down to see how much you have of X amount in your system before you start it. And there's the reason when you start Suboxone as well, it typically takes a few days for the effects to start even kicking in. But the so it goes both ways, and I know this can be confusing, but hear me out real quick. It's hard to explain in depth to people because it's hard to understand. But what I will tell you is that is why they drug test you, because if a patient comes in and says, oh, I haven't taken they go, okay, we'll start you on Suboxone, but we will start you in a couple days, and you have to be in mild withdrawal or moderate. And they'll go, okay, but then they'll take something, the day of, and then try to get on it. I've seen it where they have put somebody on Suboxone mistakenly. They had taken it, and they admitted later that they had taken some hits of actually some heroin, took a P-test, passed it. They put him on Suboxone, and he hadn't even started really withdrawal yet, and he was thrown into full-blown withdrawal, throwing up in literally the fetal position, hands and arms in a ball on his side. And the reason being why that happens is your body goes through a slight adjustment period when you first are getting off opioids, where your body's kind of overstimulated, your heart rate's up, and you have to allow this because your body was so dependent on these opioids that when you finally take that first dose of Suboxone, the first day, since you're already in withdrawal and your body knows what it's experiencing, when you take Suboxone, the first day, typically you won't feel anything. You'll typically feel like, man, nothing's working, but then you'll take that dose that second or third day. It can take up to 72 hours to actually really start kicking in. Everyone's different depending on metabolism and whatnot, but once you hit around day 2 or 3, excuse me, you'll notice a night and day difference. So that is why, if you're wanting to know why they drug test you before, why you need to have at least a day of having some moderate withdrawal. They'll get a baseline when you go in of your vitals, but they know when they go in to see if you're in mild withdrawal, they'll take your vitals again, and you have to have an elevated. Typically, you have like an elevated heart rate, 10 beats higher per minute. Your systolic blood pressure, so like normal blood pressure is 120 over 80. It typically will run around 140, 150 over something. And this is the state I'm from. These are policies and protocols. But that is why, because of the whole throwing you in severe withdrawal. So another thing is, what happens, here's a good question. What happens if I forget and talk or swallow my pills? You will not receive the full effect of Suboxone if you talk or if you swallow your pills. This medication will not be replaced, and you may have some withdrawal experiences until your next scheduled dose. Reason being, a lot of times with Suboxone, you let it disintegrate on your tongue. You can swallow it. By the way, this should be take, not talk. You can swallow it, and it will work. But some people who are on very high doses, if they don't, let's say they've been taking it the way prescribed, and it can be prescribed many ways, sublingual, swallow. But my point is, let's say you've been taking it one way and then you take it another way, you won't go into full-blown withdrawal, but you can have some withdrawal from it. So so take it as the doctor tells you to. So another thing is, missed doses. If you missed your Suboxone doses for more than 5 days in a row, then the prescribing doctor will have to be consulted before you can be given another dose. That's big. So one big difference between methadone and Suboxone is this, when it comes to the clinic setting. Methadone clinics, you typically have to go every single day. Reason being, methadone is stronger than Suboxone. It has a higher rate of abuse as well. It is a stronger dose, and it is actually it's more expensive to produce methadone. Paying out of pocket is, I'm not gonna lie, it's harsh. That's why Suboxone is typically preferred for a lot of people. But some people do better on one or the other. But the point though is when you go into the methadone clinic, you have to go every day because it is more highly abused. That when people leave, there's always going to be those people, oh, I lost my dose, I lost it. But that's why you go in every day, because if you get a week's supply of methadone, studies have shown that you're going to run out of it a lot faster because it's a lot easier to abuse and more popular to get on the streets to sell than Suboxone. Suboxone, typically you can get, especially with COVID, like a week's supply, and then you go back in. But you don't want to, if you miss an appointment, typically, it depends on where you are in your treatment program. So if you've been on it for a while and you miss an appointment, they'll typically say, yeah, come in the next day, they'll do a brief assessment, start you back on it. But if you've just started it and you're missing appointments in the beginning, I highly recommend not to miss your appointments. Because it's that really, sometimes, I know there's emergencies that happen, but that can really throw red flags at doctors. So be very careful of that, because once you're in the system and you're on it and you have flags thrown at you that you're missing appointments, it is very hard, especially in the state you live, that you're living, residents, it can be very hard to get back on the medication if they think you're using it for other purposes. Once again, everyone's different, everyone misses things, we're human, but you do not want to consistently miss appointments in the beginning in particular. Here's a big one. What happens if I vomit after taking my Suboxone? That's why I really say you want to take some sort of proton pump inhibitor, an acid reducer. That's a big thing that comes up, and it does actually happen, especially in the beginning, or you're on a higher dose, being able to keep it down, you'll get bad reflux. And typically, if you vomit after taking it, one interesting thing is you typically won't experience withdrawal symptoms because the medication has already been absorbed by the vein. Once again, digestion starts on your tongue. You have veins in your tongue, so typically, even if you throw it up, you're at least getting some of the medication in. Typically, if you're on higher doses, maybe, but I've actually personally seen patients who threw up, a little, like a couple, actually 5 or 10 minutes later, and they still got the effect of it. But once again, discuss that with your doctor, because they can put you on a proton pump inhibitor that will really help reduce those symptoms. So yeah, those are some questions about it that are common. If you have any other questions in regards to it, just put it in the comments. Remember though, I can't tell you that you should be starting this medication. I can just give it. I can talk about, if there's any video you want me to discuss, I can, but I cannot diagnose. And once again, I want a disclaimer, I've never actually taken Suboxone, but I've worked with many patients, and I'm currently in a job again where I'm going to be working on an addiction treatment unit. So I see this all the time, very common questions. So you can ask me whatever, I'm not here to judge. I've had my own addiction problems in the past. That's why I work in mental health. I've been at my lowest of lows, highest of highs as well. We're all in this together. The goal is to stay clean and live a safe, productive life. And whatever works for you, works for you. So I'm not here to judge you. Leave your comments below if you have any. Yeah, and I'll see you in the next one. I'll be putting out a video in regards to my tramadol recovery journey, which I'm doing a video every Friday on. And I'm just starting a new job, so bear with me if I'm not doing near as many videos as of late. It just has to do with working. I've been working a lot more. I'll be doing a lot of 3 shifts back to back to back of like 13-hour days, so hang in there. But you got this. hang in there. Tomorrow's Friday, let's have a great day. I actually have tomorrow off. I'm in orientation for the next 3 to 4 weeks. I've been an RN before. I've been a psych RN on a more highly. I've seen patients in drug withdrawal and who have drug addiction issues, but primarily in my past have dealt with patients in drug-induced psychosis and schizophrenia and bipolar, autism spectrum, anxiety, seasonal depression, major depression, you name it, I've dealt with it. I have treated patients for it. So if you have any questions about any of this, that's why it's the Daily Dose of Mental Health. I'll make motivational videos as well. This channel is just solely focused on some topic in mental health in one way or another. That's what the focus is. We'll have different stuff every video, but if there's anything you want me to discuss, I will discuss as well. No bullshit channel. I don't edit anything. I talk from the heart. That's what I try to do, and if I fuck up, I fuck up. That's just how it is. But I will tell you, when I was in active addiction, there's no way I would have done this shit. So, I love you all. Have a great night. Stay clean. It's worth it.